Okay, so I just made this long video. Let's see if I can summarize it here. When the Affordable Care Act was passed, it established medical loss ratios. And basically it said that an insurance company has to spend 80% of premiums on medical care and quality improvement. So that sounds like a great idea, because we should spend the majority of money that's paid to insurance companies on, actually taking care of patients. So how has that been gamed? All right. So if the percentages are regulated, that's one thing. But if we can increase the overall cost of healthcare, like the cost overall, then that 20% that goes towards shareholders and, these corporations and the C-suites, that 20% can get really big, right? So if we allow the cost of healthcare to be increased, then we're also increasing that profit pool. All right, so what's one way that has been done? Well, it's through vertical integration. So some insurance companies own, not only the insurance company, but also the doctors who are providing care. Remember that United is the single largest employer of doctors in the United States. So they could own the doctors, they can own the pharmacies, they can own all of these subsidiaries that also help provide care. So when it comes time for them to document in their accounting, like how much money are we spending on providing medical care? Well, what if they're spending this money, but they're actually paying themselves? So the money is going from the right pocket to the left pocket. Well, it seems like then there's actually not an incentive to lower the cost of healthcare, because they're just paying themselves. And at the same time, they're increasing that 20% piece that turns into profits for shareholders and the corporation.